Every year in the US, millions of families welcome newborn babies into their lives. This happy time focuses on the miracle, the gifts, the beauty of life. We spotlight the baby before and after birth. Mothers give up alcohol, coffee, sushi in order to ensure that their child has the best outcome. We take disgusting horse pills, known as prenatal vitamins, every day for months on end. And we tolerate, shall we say, rather unique cravings. I remember the time my husband came home and found me dipping pickles in peach yogurt. And I absolutely will never unsee the look and the reaction of my colleague when she walked into the office kitchen one morning and found me opening a can of sardines for breakfast. After the baby comes, we dote on them. We are religious to post a picture on Facebook every month telling the world how beautiful our baby is, what milestones they've accomplished. This celebration of our children, this dedication to them is admirable. It's natural and it's what we should do. But where we get it wrong is that we often ignore the message that pregnancy gave us about mom. You see, pregnancy is a crucial indicator of a woman's current health status. It can predict whether she is likely to get diabetes, heart disease, kidney failure, even dementia. We're missing the opportunity to address the drivers of these long-term conditions. And we're failing to intervene when she is young enough that we can make meaningful change. Tonight, I invite you on a journey, one where we will redefine and reimagine our perception of pregnancy. I want us to see that pregnancy is more than a new life entering the world, as precious and wonderful as that is. It's also a portal into a woman's health future, and it allows us to identify risks that we can change for her now. Complete, of course, comes with this, the midnight cravings and mood swings. When I developed diabetes in my first pregnancy, I was concerned that I would be in the 50% of women who go on to develop type 2 diabetes within 5 years of that pregnancy. I knew that mothers who had gestational diabetes had a higher risk, 8 times higher risk of type 2 diabetes compared to mothers who didn't. And I did not want diabetes. So I go into my postpartum visit and I ask my OB, how do I prevent this? I've got my trusty notepad ready to take notes, and she says, well, eat a healthy diet, exercise, keep your weight normal, go see your primary doctor. Okay, so several weeks later, I'm sitting in my primary doctor's office and I ask him, how can I prevent diabetes? He's typing furiously and he looks at me, looks back at his computer, looks at me again, says, Amy, this doesn't make sense why you're asking this. Your weight is normal. Your labs are normal. You're clearly not pregnant anymore. There is no problem. And these types of responses are not uncommon from healthcare professionals. In my third pregnancy, I experienced a life-threatening event. I developed preeclampsia. My liver and kidneys weren't working correctly. My blood pressure was over 200. The doctors were concerned that I was going to have a seizure, and they admitted me to the hospital, telling me that I would then spend the next several weeks with them until it was time to deliver. To say that I was scared would be an understatement. And as these things often happen, doctors aren't great at always predicting timelines. Within 4 days, I'd noticed it was getting harder to have a conversation. I couldn't talk on the phone to my mom or sister without struggling, trying to catch my breath, sitting in it. And by day 5, I couldn't walk across my hospital room without pausing to catch my breath. Turns out my heart was failing. My lungs were filling with fluid. And I am grateful to God every day that I was born in a time in history and in a country where I had access to high-quality medical care. Because if I hadn't had medical interventions that night, the chances are that my boys and I would have died. I had an emergency C-section, and for the next 11 weeks, while my boys were in the NICU, I had a lot of time to think, to ponder, to pray, to reflect. I realized that there had to be something good that would come of this. Why had this happened to me? Why was I dealing with this? And through that experience, I began to have some insight and some answers. Ironically, I had become the very patient that I help. And as a doctor, I knew I needed to make some lifestyle changes. I knew that those changes were going to have to be significant. I was 35 years old. I had 4 children under the age of 6. Because of the type of work I do, helping reduce mothers who've had gestational diabetes and preeclampsia's risk for heart disease, I knew that my risk for heart disease had just quadrupled because of preeclampsia. I also knew that early delivery of pregnancy before 37 weeks increased my risk of preeclampsia, and gestational diabetes increased my risk for preeclampsia, for heart disease. I knew that if I wanted to have any chance of watching my grandchildren grow up, I needed to take ownership for the parts of my life that I could control, leaving the rest to God, but doing my part. I knew what lifestyle changes to make. I knew how to navigate the healthcare system. I knew who to pull in to help me make those changes, and I knew how to make those changes in a sustainable way for myself and my family. Most mothers in this country are not making any changes because most mothers don't even know they're at risk for these problems. This is because our clinical practices have not caught up with the science. On average, it takes 17 years for research to be applied in clinical medicine. Even in elite academic institutions where brilliant and dedicated people are researching these diseases, the practical application of their work does not yet uniformly exist. And unfortunately, my story is not unique. In the US, between 5 and 7% of pregnancies are affected by preeclampsia. Women of color have a 50% higher risk of developing preeclampsia and experiencing poor outcomes because of it, particularly African American and Hispanic women. Globally, the CDC reports that more than 70,000 women, mothers, died of preeclampsia in 2022. Regarding gestational diabetes, conservative estimates from the CDC are that 10% of pregnancies are affected. So of the 3.5 million babies that were born last year, 350,000 mothers experienced gestational diabetes. To give this number some context, it would be like taking all 4 of the National Football League's largest stadiums and half of its 5th largest stadium, and filling every single seat only with mothers who had gestational diabetes that year. Now, this is not a lesson in statistics. It's not a lesson about possible risks. This is much bigger than those. This is the story of hope, of possibility, and of opportunity. This is the story of the mothers you know, the mothers you love. It's about her quantity and quality of life. It's about her long-term ability to live independently, her ability to maintain employment, to contribute to her family and her community. If she chooses to pursue additional pregnancies, it's about entering them in a healthier place. Now, this affects us all. Anyone here figured out how to get into this world in a way other than pregnancy? We're all the products of pregnancy. And your mother's health, when she was pregnant with you, regardless of whether she had the diseases I'm talking about, impacts your health story today. In the womb, when the baby is developing, its genes are influenced by that environment. And that influence follows all through the child's development and into their adult years. This means that my daughter is more likely to have diabetes as an adult because I had gestational diabetes. And it means that my boys are more likely to have heart disease as an adult because I had preeclampsia. These pregnancies are like canaries in the coal mines. They're warning us there's a problem. They're telling us stop and pay attention. They're giving us the opportunity to make a change. Think of it this way. If you have cancer, do you want to know about it when it is stage 1 or spread throughout your body? The best news I can give someone when I have to tell them they have cancer is, guess what? It's stage 1. We can remove it, make it go away. And when I'm working with moms who've had gestational diabetes and inflammation, the good news that I can share with them is that the underlying inflammation and insulin resistance that contributed to those processes in pregnancy is largely reducible and reversible. We really need to stop thinking about these diseases in pregnancy as being absent or present. They didn't just appear when she got pregnant, and they don't just disappear when she's not pregnant. Rather, they exist on a spectrum. And the pregnancy gave mom a gift of unmasking these underlying problems. And it is a gift because we can target these mothers for intensive preventative changes. But we can't do it in the current system. The American Heart Association, the American Diabetes Association, and other leading organizations have been calling for changes in how we reduce the risk for these mothers for more than a decade without significant progress. In January of 2024, the American Heart Association published an article from a group of researchers studying preeclampsia, and they again note we don't have a clear way forward for these moms. And they call for more research to be done so that we can figure out the best way. Now, I agree, we need research. We need evidence. But when we don't have it, we need to be looking for solutions in other places. And I propose to you that many of these solutions lie outside the healthcare system. They're beyond the exam room. They include legislatures, policymakers, and advocacy groups for sure. But let's put them over here. That leaves a whole lot of opportunity for other solutions. Some of these include schools, religious institutions, community organizations, sports teams, grocery stores, hair and nail salons, employers. We can go on. In the US today, 40 states offer women who can't afford insurance 1 year of medical coverage through their Medicaid programs. To make sustainable change is going to take more than 1 year, especially for individuals who don't know the healthcare system, don't know who to ask to help, are working multiple jobs, and don't have family support. So while this is a good start, what we need is for all 50 states to offer unlimited preventative care to mothers, and we need every insurance company to do this as well. We have many ways to ensure this happens. We can acknowledge that obesity has many of the same long-term risks that these pregnancies present. We can appreciate that there are kitchens in every elementary school where we could invite mothers and children across zip codes to learn how to identify health-promoting foods, how to prepare them so that everyone in the family will eat them, and how to store them so that the food doesn't spoil. We can teach them to do this on a budget, and whether they're living in a food desert, we can show them opportunities. Maybe, if we really want to be creative, maybe the military has ideas for how we can reach mothers in difficult places, including urban food deserts and rural communities. My favorite is that we need to completely flip the script in healthcare. We could, instead of sending a mom with gestational diabetes to a dietitian for education, we could send the dietitian with mom to the grocery store to show her what foods she's eating that are preventing or promoting diabetes. But how we get there is not the point. The point is why we need to do something different, and that is a better future for our mothers and our communities. It affects us all. There's a gap in maternal care between pregnancy and primary care. We need a bridge, and we can't wait for the system to change. You and I must act now. But what can you do? You don't work in healthcare. Maybe you're a kid. You've never been pregnant. Come close. I have a secret. You are the bridge. You can spread this message. And if there's only one thing you can remember me saying tonight, it's this. Ask the mothers in your life if they had high blood pressure or diabetes. And if they did, tell them there's an option to reduce that risk. Do you see it? Do you feel it? The impact we will have is profound, because together we can create a bridge and change the future for our mothers, communities, and families. Because pregnancy is more than the birth of a child. Thank you.